This presentation is on improving health through permanent supportive housing in Flathead County. A lack of available housing in Flathead County has been a significant problem. Housing availability rates range between 0 and 0.5%. We have to ask, what is the impact of health on homelessness, and what is the impact of homelessness on health? First, the impact of health on homelessness is that poor health puts one at greater risk for homelessness related to medical debt and other complications. Those experiencing homelessness suffer illness at 3 to 6 times the rate of others and have higher death rates and lower life expectancy. There is a high correlation between disabilities and homelessness, with 20% of individuals experiencing homelessness in 2016 reporting severe mental illness and 17% reporting substance use problems. There are many ethical considerations for housing with this project. The first thing we want to look at is the fair housing laws. This project is going to utilize a scattered housing model to prevent creating pockets of poverty, and housing will be dispersed throughout the community opposed to multiple unit dwellings in one central location. It will utilize a supportive housing model with less than 30% of one's income going towards housing costs, with subsidized payment and supportive services being offered. We will offer a low barrier housing model and will utilize evidence-based housing first models to first put housing into place prior to addressing mental health and substance disorders to increase stability. Housing units for this model will meet the needs of families, whereas the tiny home model meets the needs of only 1 to 2 individuals per household. We have to consider sustainability in order to prevent displacement of individuals and families. A lack of sustainability planning puts individuals at risk of future setbacks. Financial stability of families must be addressed through collaborative efforts with job service and educational partners. We will also provide trauma-sensitive housing options necessary to prevent re-traumatization of individuals. Multiple dwelling households or dorm-style living lack privacy and have safety concerns. We will offer secure homes in safe neighborhoods with necessary household items being provided. Housing will target a variety of demographics with a system to determine order of priority of who gets housing services when not available to all. We will look at the aging population, veterans, those with low socioeconomic status, single parents, those experiencing homelessness, and those with mental illness and substance use. We recognize there will be proponents and opponents to this proposed project, and we will prepare for both of those viewpoints through our discussions. The approach towards a resolution will include open forum to hear all options and considerations. There will be broad stakeholder invitation and hopefully involvement. Stakeholder input will be utilized for project development, and we will utilize evidence-based approaches. Those approaches may include the housing first model to address mental health and substance use. Housing as healthcare is another evidence-based model in which insurance reimbursement for housing and support services will improve health outcomes. Additionally, we will conduct data collection and research to determine our local needs and utilize continuous quality improvement for quality project outcomes. We will look at sustainability from the beginning of the project. Policy development will be broad. We must consider policies ranging from the agency level to the federal level, with coordination of policies between the various levels. Agency policy will include policy to decrease stigma and increase awareness and sensitivity. Local policies will address planning and zoning, the percent of affordable housing units available, percent of housing vacancy, urban sprawl, housing costs with the goal that less than 30% of one's income be spent on housing, and transitional housing policy for jail or inpatient reentry. There will also be policies to address various subsidy programs. State policy will include policies surrounding reentry from inpatient settings and incarceration, insurance, both private and public, that pay for housing, supportive services, housing assistance, and case management. Federal policy will include policy regarding housing as healthcare as a standard of care, and funding to programs with supportive housing, low barrier access to housing, insurance, and other assistance programs. The target audience for this proposal will include 2 phases. Phase 1 will include presenting the proposal to the local community in an effort to get key stakeholders on board. A collective impact approach to this work is likely to be most successful. Key stakeholders might range from hospitals, our federally qualified health center, insurance companies, the Department of Public Health and Human Services, planning and zoning, housing authorities, public health, our Agency on Aging, Veterans Affairs, Social Security Administration, the Department of Corrections, legal representation, schools and school-based health clinics, our judicial branch, mental health and substance use providers, elected officials, law enforcement and crisis response teams, banks, private investors and foundations, the job service, child care providers, local churches, in order to provide respite care and donation of household supplies, and public transportation and project developers. Phase 2 will include funders with a request to support project development and implementation. In the proposal, we will utilize existing data regarding current costs associated with homelessness and systems inefficiencies and benefit of cost shifting from the existing structure to this proposed structure. We will utilize storytelling with lived voice to paint this picture. We will outline the following outcome measures in the proposal to potential funders. In regards to outcome measures, there will be a collaborative committee to determine outcomes the community wishes to follow. Outcome measures might include return on investment, fewer and shorter hospitalizations, fewer emergency department visits, fewer encounters with law enforcement, and data collection considerations will be what data to collect, what collections means will be utilized to make comparable data, who is responsible for data collection and reporting, how data will be shared back to the community and funders, and if there is a return on investment, will those funds be reinvested for continuation and expansion of the project to promote sustainability. As mentioned, a continuous quality improvement effort will be encouraged to see best outcomes for the project.